Okay, self-assessment of chapter 4, which is about mental health and law. The first question from the multiple choice questions is this. A 72-year-old woman has recently been diagnosed with dementia. She continues to drive and gets shopping for her and her partner every week. He says there are no problems with her driving. What should she be advised? A. She should stop driving immediately. B. She should stop driving once she feels her driving is not as good as it used to be. C. She should stop driving once her partner feels her driving is not as good as it used to be. D. She should notify the Driver and Vehicle Licensing Agency, DVLA. E. Her general practitioner will notify the DVLA. And the answer, as we describe it within the chapter, is D. She should notify the Driver and Vehicle License Agency of her diagnosis. Then they will ask for a doctor's support and potentially a driving assessment, and are likely to arrange more frequent interviews for the license than otherwise, maybe annually or something. So it is the DVLA's decision as to whether she is fit to drive or not. Because many patients with mild dementia are found fit to continue to drive. Patient and partner reports of driving can be unreliable, as patients can have poor insight and partners may not want to act in a way that may be perceived as harming to the patient or themselves. So it's the patient's responsibility to notify the DVLA. It's not the duty of the practitioner or the doctor. Although doctors may need to do so if patients ignore this advice and present a significant risk to others through driving. But in the usual situation, it is the patient's duty. Another question. A 32-year-old man has suffered a head injury in a road traffic accident and has a Glasgow scale score of 8. A decision needs to be made as whether he should be ventilated or not. What is the best description of his capacity to make this decision? A. Capacity should be assumed to be present. B. Capacity is absent because of impaired communication. C. Capacity is absent because of impaired understanding. D. Capacity is absent because of impaired retention of information. E. Capacity is absent because of impaired ability of balance and weigh up information. And of course, here the answer is B. Capacity is absent because of impaired communication. The patient here lacks capability, as his Glasgow scale means he will not be able to communicate his decision. He is also unlikely to be able to understand, of course, or to retain or to weigh up information, of course, but this cannot be assessed actually because there is no communication at all. So the answer is B. Question number 3. A 59-year-old man has suffered Wernicke's encephalopathy and now cannot remember any new information. A decision needs to be made regarding which accommodation option he should choose. What's the best description of his capacity to make this decision? A. Capacity should be assumed to be present. B. Capacity is absent because of impaired communication. C. Capacity is absent because of impaired understanding. D. Capacity is absent because of impaired retention of information. E. Capacity is absent because of impaired ability to balance and weigh up information. And of course the answer is D. Capacity is absent because of impaired retention of information. He is likely to lack capacity for any decision requiring more consideration than is available in working memory, as he will not be able to retain information for long enough to weigh up, for example. So that's it. But as a guide, someone should be able to retain information for as long as necessary to make a decision. That's the point. A quick decision like meal choice does not require a long time to make. A big decision, for example, like where to live, would normally be something that a person would consider and mull over for a few days at least. That's why we are talking about this, impaired functioning, impaired retention of information. That's how it affects capacity. Okay, another question. A 34-year-old woman is experiencing a manic episode with psychotic features. She broke her leg jumping off a bus shelter but denies the need for surgery, as she thinks she can heal her leg herself. The decision is whether she needs surgery or not. What's the best description of her capacity to make this decision? A. Capacity should be assumed to be present. B. Capacity is absent because of impaired communication. C. Capacity is absent because of impaired understanding. D. Capacity is absent because of impaired retention of information. E. Capacity is absent because of impaired ability to balance and weigh up information. And the answer is here. So let's just see it like this. This patient lacks capacity for the decision about surgery, as she does not believe the information because of the delusion, of course. However, she is likely to have the capacity to make decisions about which she does not have delusions about. So it's about impairment of understanding, because delusions affects her understanding of the situation. So capacity is absent here because of impaired understanding. Another case about capacity. A 55-year-old man has schizophrenia with chronic auditory hallucinations and negative symptoms. The decision is whether he should take a statin or not. What is the best description of his capacity to make this decision? A. Capacity should be assumed to be present. B. Capacity is absent because of impaired communication. C. Because of impaired understanding. D. Because of impaired retention of information. And E. Because of impaired ability to balance and weigh up information. And the answer here is A, despite delusions and hallucinations. He should be assumed to have the capacity to make a decision about statin, unless his psychotic symptoms relates to cholesterol and such things, which is usually unlikely actually, or the patient is disorganized and he has very severe thought disorganization. But usually, if there is any kind of auditory hallucinations and symptoms that are not related to statin or cholesterol level or something, the patient is capable to make his own decision about this. So now with the extended matching questions. Here we have something about legislation, We have mental health legislation, mental capacity legislation, forensic mental health legislation, criminal legislation, no legislation required, and common law. So which type of legislation could help in the management of the following cases? Again, mental health, mental capacity, forensic mental health, criminal, no legislation, or common law. Here we have this case. A 26-year-old man with schizophrenia and comorbid depression. He is currently severely depressed with an active plan to commit suicide by hanging himself. Okay, by hanging. He lives with his mother, who does not feel he is safe to go home. He is refusing admission because he thinks the doctors want to torture him. Here we can use the mental health legislation, because this man has evidence of mental disorder, which is depressive episode with psychotic symptoms. And these symptoms significantly affecting his ability to make decisions about his treatment, of course, because he is delusional about, he will be tortured by doctors. And he is, of course, at high risk because he has this active plan of suicide by violent means. He wants to hang himself. This is violent. This is serious. And he has mental disorder and he is a young male. All of these are risk factors. And hospital is the least restrictive option actually here. And risk cannot be managed safely at home. So he therefore meets the criteria for detention under the Mental Health Act. So under mental health legislation, we can admit the patient. Another case. A 26-year-old man with schizophrenia. He has been charged with attempted murder after he attacked his mother, who he believed to be trying to torture him by whispering derogatory comments to him all night, even while he was staying at a friend's house. So it seems there's something about, trying to kill someone and blah, blah, blah. So forensic mental health legislation is the answer. Because this man has evidence of mental disorder, of course, psychotic symptoms, and has been charged with serious offense. The severity of his charge means he needs assessment and treatment under forensic, not civil legislation. So that's why we use forensic mental health legislation here. The third case here, a 26-year-old man with schizophrenia. He has been charged with a breach of the peace after he repeatedly shouted in the street at 2 a.m. He told the police that he was telling the voices to go away because it did not work. He is now considering suicide. Okay, so because it did not work, he is now considering suicide. Here, we are again talking about mental health legislation because this man meets criteria for detention under Mental Health Act, as we said for the first case. Why is that? It's obvious because the patient here, yes, he is charged by police, but this is not a crime or severe crime. So it is not severe enough to be managed under the forensic legislation. So we get back to the Mental Health Act. Another case, a 26-year-old man with schizophrenia. He has been brought into the accident and emergency department by ambulance after an attempted hanging. He is unable to speak and has stridor and low oxygen saturation. So, for example, in this example, the patient is in emergency situation. We use the common law because it is in this man's best interest to receive aggressive airway management and oxygen. He currently lacks the capacity to consent and he is unable to communicate, of course. So treatment under common law is indicated to sustain life and to prevent serious deterioration. The fifth and the last case, a 26-year-old man with schizophrenia. He suffered a hypoxic brain injury after attempting to hang himself and now has very poor short-term memory. He needs treatment with antibiotics for urinary tract infection, but he does not realize he has one. The need for antibiotic has been explained to him on 3 different occasions, but he does not recall the information by the time he is due to receive treatment. So here we can use, the mental capacity legislation because as this man needs treatment for physical problem, mental health legislation, it's not about mental health legislation. It's about physical problem, even though it's the cause would be mentally. But when we are talking about when we are talking about physical problem, it's about mental capacity legislation. mental capacity legislation. He lacks capacity as he is unable to retain information, of course, and it's not an emergency, so it's not common law. It is mental capacity legislation. Anyways.